Hello everyone, I'm Nicholas Dimitriadis and welcome to my channel. I'm a first year resident in a Greek hospital, and today we're going to talk about a case about an 82 years old patient, male, who came 1 month before due to decreased visual acuity. In the examination we observed that this patient had a nuclear cataract, and there was nothing that made us afraid in order to continue with the phacoemulsification. So 2 weeks after, we had the surgery with no intraoperative complication. Everything went by book, and after 2 weeks this patient came back to us. So in the examination we saw this image. This is a case of an iris prolapse. If the iris was just tamponating the main incision, we wouldn't have a problem, but this iris is exposed in the environment. We were calculating that it was like 10 days that this iris was exposed in the environment, so there was increased risk for endophthalmitis, for infection of the anterior chamber. In our case, this patient had also an orthopedic problem, so the tension that he had made the iris to prolapse. What are we going to do in this situation? First of all, my consultant told me that this was your case, so you have to go intraoperatively and fix it. That's exposed like 10 days in the environment is prone to infections. So first we have to cut it, then place some viscoelastic, and then suture the eye. Give the classic antibiotic with steroids, and there will not gonna be any problem. This is the solution. Inside the surgery, and I proceeded as you can see in the following video. This is a case that every resident must know to fix, because after a cataract surgery, this is one of the post-operatively complications that someone can face. It's really easy to fix it, but you have to take the right decision. What are you gonna do with the iris? If the iris is like prolapsed for 1-2 days, there's no risk for infection. You put the antibiotics in the anterior chamber, you place the viscoelastic, you suture the eye, and there's no problem. But this was an iris that was exposed like 10 days.